Sunny. This is Gwen Cox. I am a Senior Improvement Advisor with Comagine Health. And today we're going to be talking about nursing home visitation and vaccination status. And I know that just sounds like a scintillating topic, but there were some interesting little quirks in the visitation rules. One of the things that we do know is that the millions of vaccines that have been administered have been shown to help prevent symptomatic COVID-19. One of the things is it may not always prevent COVID-19, but it will definitely decrease the severity and the length of the illness. And nursing homes are required to educate your residents and your staff on the risk and benefit. You have to offer the vaccine and report resident and staff vaccination to the CDC's National Healthcare Safety Network, or NSHN. So that means, providing education on a routine basis for your staff, for your residents, and working with either a pharmacy or stocking the vaccine if that is something that you're able to do, or directing your staff to vaccine clinics. Some places have mobile clinics, others, will have physician office vaccination hours. So if you want to, you can visit medicare.gov/care-compare to see how many residents and staffs have received the booster as well as the vaccine. And the data can be tracked by a specific nursing home. So if I go in and I enter, okay, I live at 624 Pine Grove Avenue in Grayson, Georgia, every nursing home within so many miles of me will pop up. I can compare the two nursing homes or three nursing homes, but I can also just look at that nursing home to see their vaccination and their COVID status. So it's something that's really interesting to do. To just look at the differences in nursing homes, especially across the country. Our current data show that the rate of booster shots for residents is comparable to the national average. And for resident booster shots, the national average is 66.8. So still got a little ways to go with that. Resident rate of the vaccination series is 87.4. And again, that's a national rate. Staff vaccinations are coming in at 82.1%. And this is the one that just kind of makes your jaw drop. Staff booster rates are 31.8% nationally. And not sure whether that is, because they haven't been out that long, it may be hard for staff to find where they can get a vaccination, but those boosters are definitely lagging, and they do offer additional, additional protection from the virus. And CDC has actually come out and said the boosters are the thing that most likely will prevent or decrease the symptoms of Omicron. So, it's a good thing to get your booster shot. So let's talk about visitation guidelines. Why now? It seems like it's kind of a weird time to do it because we do have the Omicron variant running around. But CMS has recognized that physical separation from families and other loved ones have taken a physical and emotional toll on residents. And we had talked about this earlier in the pandemic, about the rates of depression, patients declining in health, simply because of the loneliness and the feelings of isolation. And, it's really hard when their loved ones can't come in, when they just see them through the window, or they have a FaceTime. It's still not that personal touch. So CMS has said, okay, we recognize that. So they also had to look at 42 CFR 482.10, which states that residents have the right to receive visitors of his or her choosing at the time of his or her choosing in a manner that doesn't impose on the rights of other residents. So when CMS issued this guidance, they were talking about when we first had the pandemic, they could, based on the clinical and safety measures for nursing homes and other hospitals, that they could restrict visitation because it was a public health emergency. Now that it's settled down a bit, they don't feel like that they can restrict visitations because it will be a violation of a patient's civil rights. So that's one of the reasons that they're really choosing to go ahead and open visitation. And then kind of the third is the COVID-19 vaccines have received full approval and emergency use authorization from the Food and Drug Administration. So they feel like, okay, they have the right and we have vaccines now. So that's why they've chosen to open visitation again. And on the guidelines, visitation can occur in the resident's room, in dedicated spaces, and outdoors, which I thought, oh, that's nice, except when it's 23 below. But when spring comes, that will be a really nice thing to do for residents. Regardless of where visitation occurs, the core principles of COVID-19 infection prevention are to be used. If you need a copy, we can send you one. It's also listed out in the regulation for visitation, but it's things that the facilities have been doing all along, screening visitors, hand hygiene, face covering, physical distancing, signage in the halls, and directing visitors, go to the patient's room, come back. Don't wander around. Cleaning frequently touched surfaces, appropriate use of staff, PPE. If you have residents who are positive for COVID or are on a quarantine status, cohorting those patients into one area. And then your testing, your resident and staff testing still continues. And this is defined in OSO 2038 nursing homes. So sometimes that can be hard to find. And we will be happy to send that to you if you need it. Outdoor visitation is really preferred when you have a resident and a visitor that are not fully vaccinated. You can have vaccinated visitor and residents visit outdoors if they choose. And outdoor visits really pose a lower risk because of the increased space and airflow. One of the things that the guidance says, and that's kind of common sense, is that facilities must create safe outdoor spaces for visitation. So you can't just, do it in the parking lot. Early on when this happened, there was a nursing home, and I can't remember where it was, but they had created a little visitor hut. And the family went in one door, the patient went in the other door, and there was like a screen between them, but they could actually see each other, talk and feel like they were closer together. So I thought that was a really unique way of doing visitation. When and that's not really considered an outdoor visit, but talking about courtyards, garden spaces, things like that, that would be a safe outdoor space. When you're doing indoor visitation, you have to allow it for all residents because it is permitted under the regulations, which we've talked about earlier. The length and number of visitations cannot be specified. That surprised me, that you can't say you can visit between these hours and these hours and only one person. But according to the regulation, that can't be specified. And even though visitation has been open, those core principles of infection prevention that we talked about have to be adhered to. so that it doesn't pose a risk to other residents. Again, during these indoor visits, your visitor movement needs to be restricted. They should go directly to the patient's room or to the designated visiting space. So if there's, a room that's off of a main corridor and you've chosen that to be your visitor space, the visitor should go there and nowhere else, and should be masked and 6 feet of physical space between the visitors. Again, if your resident's roommate is not vaccinated or is immunocompromised, regardless of their vaccination status, so if they're vaccinated, the visits really should not be conducted in the resident's room because they are immunocompromised. If the health conditions prevent the movement of the resident, if that patient cannot be moved, the visit can occur in the room if there's adherence to the core principles of infection prevention. So to me, this one is kind of a hard one to decide what to do. I guess if the person that's being visited can get up and walk out to a designated visiting space, that's the best thing. But then, they turn right around and say, if that can't happen, then you have to adhere to the core principles of infection prevention. So that one is a little strange, but that's CMS. So if in your community transmission levels are substantial to high, all residents and visitors should wear face coverings and maintain physical distance. If it's low to moderate, it is still the safest practice to wear a mask and use physical distance. When a patient is on transmission-based precautions or quarantined, they can still receive visitors, although it's not recommended. These visits should be conducted in the resident's room. They should wear a well-fitting mask if they're able to, and visitors and residents both should be made aware of the risk and needed precautions. Visitors should adhere to the core principles of the infection prevention, washing your hand, face mask, and this is vaccinated and unvaccinated residents and guests are allowed physical contact. In other words, they can hug each other, they can hold each other's hand, but again, they have to be advised of the risk. So whether you use a piece of paper that they sign or you talk to them in person, you need to document that you have advised them of the risk. And one thing that should be noted is that you are not required to furnish face masks to visitors. They should come in with their own face mask. Again, indoor visitation during outbreak investigation. If you have an outbreak, you need to perform your routine testing, especially of the unvaccinated staff, testing of individuals with symptoms, and outbreak testing. Visitors can visit during an outbreak investigation. Again, they have to be advised of the risk and they have to adhere to the core principles of infection prevention. The visits should take place in the resident's room and masks must be worn regardless of vaccination status. So again, if you have an outbreak in your facility, you can still have visitors, but you really need to make sure they understand the risk and they're willing to follow the infection control or infection prevention rules. Compassionate care visitation, nothing has changed with that. Those visits have always been allowed or continued to be allowed. Visitor testing and vaccination. CMS really encourages all visitors to be vaccinated as well as all residents and staff. You can ask about a visitor's vaccination status, but they're not required to be tested or vaccinated in order to visit. However, if they choose to decline to disclose their vaccination status, they must wear a mask. And again, the facility is not responsible for providing that mask. Access to the long-term care ombudsman, I'll get it right, and federal protection and advocacy programs. Again, if the community transmission is substantially high in the past 7 days, the resident and the ombudsman should be aware of the risk. If an alternative communication is desired, the facility must facilitate alternate means like via phone, video conferencing, so the visit can take place. If the federal protection and advocacy representatives visit a patient who is in the transmission-based precautions or quarantine or unvaccinated, they should be made aware of the risk, and the visit must take place in the residence room. So again, cannot restrict visits from federal protection and advocacy programs or the long-term care ombudsman. The ADA guidelines are still enforced during this time, and that would mean things like TTY for the deaf, if you need an interpreter, if the patient's blind and perhaps you need a Braille, speaking person, or sign language, those sorts of things, all of that's still in effect. And again, the folks that come in need to adhere to the infection prevention standards. If masks and physical distancing are still in effect, that needs to be upheld as well. This one, returning to the facility after an outing, you have to screen your residents for signs or symptoms of COVID-19 when they return. If they report a possible close contact to an individual with COVID-19, test the resident regardless of vaccination status and place the resident in quarantine if they haven't been fully vaccinated. So for the vaccinated resident, they have to be tested. If they have not been fully vaccinated, the patient or the resident has to be placed in quarantine. Again, if the resident develops signs and symptoms, test the resident and place the resident on transmission-based precautions regardless of vaccination status. So sometimes for me, this can get a little bit confusing about what do you do with the unvaccinated versus vaccinated. But it's one of those things you're just going to have to look at the fine print in the guidelines to determine, do I put this patient on transmission-based? Do they go into quarantine? If a patient goes on an outing, you may choose to test unvaccinated residents who don't have signs or symptoms, who leave frequently or for prolonged periods of time. And CMS defines prolonged periods of time more than 24 hours. So you can consider quarantining the unvaccinated residents who leave the facility if your assessment of risk that proper infection control or infection prevention measures have not been taken. And this can be by the resident or by the family members or wherever they visited. So if you think that this didn't happen, then you can quarantine unvaccinated residents. If they leave for more than 24 hours, they should be managed as new admits or readmissions as recommended by the CDC. And again, there are exceptions to quarantine, including for the fully vaccinated residents. So the interim guidance that the CDC has put out would be a good place to find those exceptions to quarantines. So that's pretty much a quick overview of the guidelines for visitation. Does anybody have questions about any of that? You can put them in chat. We have someone monitoring our chat.
No questions so far, Gwen.
Okay. Well, I'm going to go ahead and if you think of some questions or you want to know something, put it in chat or just interrupt me. That's fine.
This is Donna. I don't have a question for you, Gwen, but I do have a question for the two people that have joined us from the centers to ask them what the biggest challenges have been for them with the opening up of visitation for their residents. I don't know if they're willing to take themselves off mute to say, or if they just want to type into chat.
And then I think kind of going along with Donna's question. Oh, we have.
I was just going to say, Donna, Sunny asked if you could repeat the question. And then Lori, you actually mentioned to me directly, and she said getting the families to buy into the hoops, as they put it, is one of their challenges.
I didn't realize it was direct to you.
That's okay. No problem at all. Thank you for pulling yourself off mute, though.
By the hoops, do you mean the screening and all of that, Lori?
Yes, and then I'm in Southern Oregon, and sometimes down here it's interesting at best trying to get families to buy into just about anything. So
yeah, Sunny, the question was, what have been the challenges for you with opening up visitation for your residents? And one of the things that I've heard from some centers is that, with the mask mandates going away, they're horrified that they have to put a mask on to come into the center, not realizing that the rules are a little bit different because it is a care center, not like a public, like a grocery store or something like that. So I'm just curious, Lori sharing about the hoops. I think some areas of our region, there are people that are less likely to have vaccinations than others, and that may be part of the challenge as well. Thank you, Sunny, for saying that you haven't had any big issues.
One of my questions is where the guidance says that the patient can have as many visitors as they choose for the length of time that they choose. Is this something that routinely happens with you guys? Somebody comes in and stays all day, or, they have, 3 adults and 4 grandkids. How do you handle that?
I don't know about that question, Gwen, but I find it very interesting. As you said, that we're not actually supposed to be limiting visitors. My sister is in a care facility and they absolutely have a visitor limitation. So I think that's interesting hearing that it might not be part of the rules, but some places might make their own rules.
Yeah. And then Lori says they still use social distancing, so allow as many that can fit safely in the room. So, do you guys let children visit?
we have, we encourage them to visit up front, but we have allowed it.
Okay. Do you require that the kids wear masks?
Yes.
What are some ways that you guys have educated staffs, families, and residents about the vaccine and the booster? Any innovative ways? I know you were talking about being in Oregon, it's a bit difficult. So have there been things that seem to have really hit home with folks, or is it still the, okay, thank you for telling me that?
Lori, I'm also in Southern Oregon, and I find it very interesting, the amount of people just going to the grocery store that refuse to wear a mask.
Yeah, absolutely.
Where in Southern Oregon are you located?
Medford?
Oh, okay. And I'm over on the coast in Brookings.
Oh, okay.
And I feel like in Medford, it's a little bit more of a populated area, right? And so you would hope there would be more people jumping on to get the community immunity going.
Yeah, it's definitely, we have both sides here. We have the anti-vaxxers and we have the people that think it's a conspiracy, and there's just all of it.
Does it cause much disruption when you have visitors come that are anti-vaxxers?
Usually, we have a good process that we have in place.
Oh, great. Can you share that process?
Well, we actually take appointments. We encourage appointments, I should say. We encourage people to stay an hour or less.
Okay.
And so even with the anti-vaxxers, we say you need to wear a mask. If you don't wear a mask, then you have to visit up front because the social distancing can't be maintained.
Sure.
Sunny, where are you located? You may have told us and I missed it.
Sonny's actually in Las Vegas, Nevada, I believe. Yeah. He's saying that we only allow visitation in patient rooms and outside. As far as vaccines and boosters, I look up vaccination status. And if I notice the patient has not completed the series, we offer to take them to get their vaccine/booster. I provide a folder on admission with vaccine information, but I meet with all new patients personally to discuss options on how to get a vaccine. Sunny, I'm curious, when you say you take them to get the booster, you're not able to provide it? You don't have a pharmacy partner that comes into your center to provide the vaccine? You drive them. Would you like us to contact you to talk a little bit about how you might be able to work something out to get something in your center for residents? Wonderful. Tabitha, I'm going to turn that over to you.
That's awesome. Sunny, I will give you a call later today, if that's okay. And if you're not available, we can schedule another time to talk. Thanks, Donna.
Thank you. And thank you, Sunny, for sharing that with us.
What about you, Lori? Do you take your residents out of your facility, or do you have somebody that can come in for you?
For America actually provides them to us, and we do clinics.
Oh, okay, great. Do you offer vaccines to the residents' families as well, if they're interested?
Yes.
Great.
Excellent. When I was looking at the stats for residents who haven't taken the booster, do you guys have any thoughts about why, if they've been vaccinated, the vaccination rate is fairly high, but the booster rate is, fairly low. So if you guys had any thoughts about why that may be happening?
Well, part of ours was we had the monoclonal antibodies, and people are just coming off their 90 days from that.
Lori, you might be interested to hear the CDC has now said that guidance takes that delay away.
Oh,
I was surprised to see that as well. The That just came out on the 11th of February.
Oh, thank you for that.
You're welcome.
But we're slowly getting better numbers.
And what about the staff? You know, the rate has lagged behind, but the booster rate is at, you know, like 31%. So what are staff telling you about the boosters?
A lot of people only got their vaccine because they had to.
Are you guys making the boosters mandatory?
We have, our company hasn't done that yet.
I feel like that really changes people's perception about the vaccine as well, whether it be a personal choice or a mandate. So, you know, being told you have to do something has really put people in an unusual circumstance for, you know, when talking about vaccinations. This is new for these days.
This is Donna again. We are going to have woman from a center speak a little bit about the reluctance to get vaccines on February 25th on our open office hours at 11. So if you're interested in that, you might want to join, and you can have a conversation with her to speak about what she's encountered and what she has done.
Staff are mostly vaccinated. The problem is that we also use agency staffing, and not all of them are vaccinated. Okay. Is it local agency or travel nurses?
That's really interesting because I think a lot of places are using staffing agencies, right? I hadn't considered whether or not the staffing agencies required vaccination.
I know I was looking at some ads for the travel. Oh, okay, travel not vaccinated. Some of them say you're required to be vaccinated, others don't. So that's an interesting, they request, but I don't think it's a mandatory. Yeah, I think you're right. That's kind of what I was reading into the article about travel nursing. One of the other things that I wanted to mention to you guys, there are some state specific guidelines. And in Oregon, you can see there's a website. New Mexico, Utah, and then Washington has a couple. I could not find online resources for Idaho or Nevada, but I do encourage you to check your Department of Health sites or your whatever it is you call your health I'm having trouble speaking today. Health Regulation Board. So Utah had some interesting language, and then New Mexico pretty much followed the guidelines very, very closely. Didn't see any big changes there. Again, the same thing with Oregon.
Well, Gwen, thank you so much for the presentation today. And Lori and Sunny, thank you so much for interacting with us. We are learning from you as well. So thank you. All right. If there aren't any further thoughts or questions, I believe we'll close out the webinar. Thank you all. Have a wonderful day.
Thank you, guys.